So those were the transfer section. This is another very commonly asked section in the exam, which is the mid-sagittal section. Now if you see this mid-sagittal section, now what all you could see is this black area. Again, this is anterior, this is posterior. So this is nothing but frontal sinus. This is frontal sinus. This structure that you could see, again black, this much black on MRI means air containing. So this is sphenoid sinus. This is sphenoid sinus. Just above the sphenoid sinus, you see this structure, which is this, and this is sella turcica on a radiograph, but in MRI you can directly see the gland. So we call it as a pituitary gland. We call it as a pituitary gland. Now what are the important difficult MCQs that you could see from here? Can you see this white area in the pituitary gland? This is posterior pituitary. This is called as posterior pituitary bright spot. This is called as posterior pituitary bright spot. Now the question that you may get in the exam, again it's a clinical question, but major crux of the question is loss of posterior pituitary bright spot. Loss of posterior pituitary bright spot. That means you are doing an MRI and you are not seeing this posterior pituitary bright spot, and the examiner is asking you is a feature of which disease. Loss of posterior pituitary bright spot is a feature of which disease? And again, take care. Do you know what will be the first choice? The first choice will be Sheehan syndrome. The first choice will be Sheehan syndrome, which is wrong. Loss of posterior pituitary is not a feature of Sheehan syndrome, but Sheehan syndrome is a disease of anterior pituitary. And posterior pituitary, there are very few diseases of the posterior pituitary that should think of. It's a feature of as central diabetes insipidus. Loss of posterior pituitary bright spot is a feature of central diabetes insipidus. So that means you are doing an MRI, the patient has a clinical feature which are favoring the diabetes insipidus. Now you want to differentiate whether it's a nephrogenic diabetes insipidus or central diabetes insipidus. If you do an MRI and you don't see posterior pituitary bright spot, think of a central cause of diabetes insipidus. Okay? Alright. Now this is the pituitary gland. Please remember, above the pituitary gland is the space that you are seeing. See, this is sella. Above the sella is the space which will be, if I just label it up, this space, this space that you could see is suprasellar space. Suprasellar space. Now, question that you may get, it's an image-based question that you may get, the most common tumor seen in suprasellar space. The answer that should come to your mind is craniopharyngioma. Craniopharyngioma. The most common tumor seen at the suprasellar location is craniopharyngioma. However, you have to remember, if the tumor is in the sella as well as in the suprasellar, sella as well as suprasellar, so this is sella and this is suprasellar, then your first answer should be pituitary macroadenoma. Then your first answer should be pituitary macroadenoma. Okay? Alright. Now, this structure that you could see is very simple. You all can easily appreciate this. This structure is corpus callosum. This structure is corpus callosum. You know, this is midbrain, this is pons, and this is medulla. So you can write it down. This is midbrain, this is pons, and this is medulla. And this is medulla. What is this structure that is lying here? Between the cerebellum, this structure is cerebellum. This is cerebellum. And in between them, this white that I marked white is fourth ventricle. Is fourth ventricle. Okay. Now similarly, you can see a CSF space in front of the pons. You can see a CSF space in front of the pons. This is the CSF space. Since it is anterior or in front of the pons, we call it as prepontine cistern. Prepontine cistern. And anybody who can tell me what is the vessel that present in prepontine cistern? Which vessel is present in the prepontine cistern? Answer is basilar artery. It is basilar artery because it is this prepontine cistern that is extending superiorly and merging with the perimesencephalic cistern. And it is merging with the perimesencephalic cistern, and actually it is this basilar artery that is going up and it is dividing into two posterior cerebral arteries. It is this basilar artery that is going up and dividing into two posterior cerebral arteries. Getting it? Okay.